Andrew Gwynne, let's start with you. I mean, Jeremy Hunt also said today this is Labour's darkest moment. Is he right?
Well, no, because, of course, of these 14 hospitals that Sir Bruce Keogh has looked at, the issues that are surrounding the mortality data, of course, refer to the previous 2 years. Now, yes, it's true that of some of those hospitals, including my own, there have been long-standing problems, but it's unfair to say that Andy Burnham did nothing, because in 2009, I and my fellow Tameside colleagues went to see Andy Burnham as Secretary of State, and he actually ordered the Care Quality Commission to go in unannounced and to have immediate spot checks and put Tameside Hospital on notice.
Charlie Elphicke, is your Health Secretary playing politics with people's lives here, given that your party's been in power for 3 years and not done anything about this either?
What we're saying is what's really important is we've got to have really great quality healthcare. You can't just have...
But is it fair to say it's Labour's darkest moment?
Situation. Well, I don't think that Andy Burnham covered himself in glory in his Health Secretary, but the key thing is how we move forward from here, how we can ensure that we can trust our hospitals, trust our health services, and know we're going to get really good quality care.
I mean, do you think you've got a case to answer for, that there was a Labour, when Labour was in power, there was a feeling of covering up and not being transparent? Because these are big accusations being labelled towards you today, aren't there?
They are big accusations, and they are also false accusations, because, of course, it was the Labour government that introduced the mortality data and published it online for people to make of that what they wanted.
So why are we in the situation now?
Well,
then?
we are in the situation that we're in now predominantly because there have been 4,000 nurses cut from the NHS in the last 3 years, including over 1,100 nurses in the hospitals that Sir Bruce Keogh has identified.
OK, Charlie Elphicke, how do you respond to that?
Well, the issue here is not the number of nurses and all the rest of it. It's all about quality of care. It's about putting the patient first.
And that hasn't happened, has it, under your watch too?
We've been taking the measures that are necessary. We're not in denial. Andy Burnham ignored about 1,500 complaints or something extraordinary like that. We're saying we're not going to have this. We're going to have openness, accountability, transparency, and we're not going to stand by while hospitals fail. We're going to make sure they provide the care people need to have. Because
the problem is people watching this, Andrew Gwynne, will think they're in the middle of a political football between you guys, and you're not really focusing on who's important here, and that's patients and people who are in hospitals tonight. What would you say to that?
And you're absolutely right, and I think that is part of the problem, how this has been overspun over the weekend by the government, because what we should have been doing is focusing on the future. I've just come from a meeting with Professor Bruce Keogh, and he made it quite clear he's not interested in the past, he's interested in the here and the now, and how we get that better care to patients such as those at Tameside.
Are the dark arts of spin doctors at play here?
No, I don't think so at all.
Where did those numbers come from this weekend then? So Bruce Keogh was furious that part of his report was leaked, wasn't he?
Well, I can't answer for that. What I can say is, obviously, Andy Burnham's credibility being in tatters, to me, is a side issue. What matters is how we go forward, how we get the kind of health service we can totally trust and have absolute confidence in.
OK, let's talk about that, the future now. Andrew Gwynne, please listen to this, because we did talk about your local hospital trust, Tameside. We spoke to a gentleman called Mike Stones, whose 12-year-old daughter Emma actually died at the hospital after suffering from infection, and the hospital staff failed to adequately check her condition. Let's have a listen to what he had to say about that.
Absolutely destroyed me. Destroyed the family. It's just a life sentence. And what do you do when you go to a place? You take it for granted. This is the best place for your daughter to be.
Dreadful situation. I have to say the hospital has apologised to Mr Stones, but as his local MP, what do you say to him?
What I say to him is that the standard of care that his family received fell below that which the NHS should be providing. And of course, that is why, actually, for the last 3 years, I called for the chief executive
at Tameside Hospital. So you've known for a long time that standards were not good at this hospital trust?
Absolutely, which is why we went to see Andy Burnham when he was the Secretary of State, and Andy Burnham ordered the Care Quality Commission to go in.
3 years later, nothing's happened.
But you know what was absolutely scandalous, Emma? That for all the time, from 2009 until this year, the Care Quality Commission said that Tameside was failing. This March, the Care Quality Commission issued a report giving the hospital a clean bill of health. 3 months later, Keogh's damning the place.
Charlie Elphicke, you've also got problems in your constituency of Dover and Deal. You don't even have a local hospital, do you? What are you doing about that?
I'm trying to get one built, and one is being built as we speak. The project's moving ahead, and that's really important in terms of access to healthcare. But the most important thing about this is what we're saying is the patient comes first, has come first, above the institution, above the people who work in the institution. They're not there for their own benefit. They're there for the patient's benefit, and that's why we've got to be exacting, just like we are with schools.
Talk about the future. So Bruce Keogh says more nurses need to be employed. Where would you find the money for that, Andrew Gwynne?
Well, I think what we've got to do is we've got to ensure that the health and social care budgets are pooled. This concept of whole person care then starts to...
So where would you find the money for
that?
that?
Well, that actually releases substantial amounts of money because there's a lot of duplication between health and social care, and that's why Labour has put forward plans for whole person care, because actually it's not just better for the NHS budgets, it's better for patient outcomes too.
And Charlie Elphicke, for people who are sitting in those hospitals tonight, they've been labelled risk measures or special measures, what's your message to them? Should they move hospital, do you think?
My message to them is really simple. We are taking action. We're sending in, proper squads to deal with the issue, to take the special measures that need to be taken. But the key thing is here, this is why we ring-fenced the health budget. Labour wanted to cut it, but we ring-fenced it to protect health spending.
And Andrew Gwynne, would you be happy to have an operation at Tameside Hospital tonight?
Yes, I would, because actually Tameside Hospital and most of the staff at Tameside Hospital provide decent care. What Keogh has found is that in some areas that care has fallen below standard, but actually I want to pay tribute to many of the decent, committed, hard-working staff and carers at Tameside Hospital and all NHS hospitals, because they'll be feeling pretty battered and bruised.
We have to leave it there, gentlemen. Thank you for your thoughts tonight.